Let's talk health now. Every year, millions of people around the world unite to shine a light on one of the most pressing health challenges of our time. It's called cancer. On World Cancer Day 2026, the global community is renewing its call for awareness, early detection, and equal access to quality cancer care. TVC News' Kemi Balogun has more.
Breast cancer remains the most commonly diagnosed cancer worldwide, accounting for more than 2 million new cases each year. While the disease affects women far more frequently, health experts warn that men are also at risk. Male breast cancer accounts for about 1% of all cases and is often detected late due to low awareness. Jacob Omonade is one of the few men diagnosed with breast cancer, a reality many still find difficult to believe.
2024, that was April. I was getting dressed for work in the morning, and while I was getting dressed, my wife noticed that there was a black patch underneath, So she was not like, that's why, that's, as in she was just questioning me, what is that dark, this thing, your body? So I was not like, what? So that was when I checked. And when I checked, I discovered that it was where I had that lump that, it had increased in size and it was now having black patches at the surface of it. So that was when I got really, really scared.
According to the International Agency for Research on Cancer, 4 in every 10 cancer cases globally are preventable. The agency estimates that about 37% of new cancer cases recorded worldwide in 2022. Diagnosed at almost 50 years, Jacob tells us it has not been an easy road as he seeks better health systems that will support care for cancer survivors like him.
I want to appeal to the government to please try and set up get more machines, because a whole lot of the problems that we actually face as cancer patients is the fact that the care is very, very poor. And you go to hospitals, you find out that before you see a doctor, it's 1 month, it's 2 weeks.
Some experts believe this year's theme, United by Unique, should be measured by whether prevention reaches those with the least access, with conversations around this issue never been more urgent. Kemi Balogun, TVC News, Abuja.
I'm joined now by radiation and clinical oncologist at the MedServ Luth Cancer Center, Dr. Bukola Oshinkolu. Doctor, thank you for joining us on the news tonight.
Thank you for having me.
We hear that 4 out of every 10 new cases of cancer can be prevented. Let's begin from there. What is that thing about prevention that we're not getting right?
Yeah, so prevention, because majorly cancers, we do not know exactly what causes most cancers, except for cancers like cervical cancer. And therefore, there are risk factors associated with different cancers. So when we talk in prevention, we should be talking about ways of reducing risk factors associated with different cancers. And many people are becoming, the cancer awareness is really increasing. So many people are becoming more aware of things that they should do and shouldn't do if they want to stay healthy and they want to stay, free of cancer. So in terms of prevention, we all need to adopt a healthy lifestyle, including screening. Because most cancers, when they start, they're usually what we call asymptomatic, meaning no symptoms whatsoever. For example, breast cancer, commonest cancer in women worldwide, it starts with a painless breast lump. So if a woman isn't aware that she should do a self-breast examination once a month, and she's not doing that, and the breast lump develops, and she's unaware of it, and it progresses, continues to increase in size, and eventually one day becomes painful. By the time it becomes painful and attention gets drawn to it, it might be too late already.
Are you saying you don't have to see symptoms before you go for screening?
No, you do not have to see symptoms.
So how easy is this screening? Is this something I just leave work at 5 p.m. and go get it done? How affordable is it?
In terms of affordability, it may not be that much affordable, but it's something that if you plan for it, you can get it done. For example, some people, when they want to celebrate their birthdays, especially for parents, elderly parents, 70th, 60th, and so on, they throw a lavish party. Instead of throwing lavish parties, you could decide that, okay, mom, dad, for your birthday this year, no parties, I want you to go for health screening, so that if there's anything we can pick up during the screening, we pick it up and deal with it early.
How many people will appreciate that as a birthday gift? When there's the option for obli. You had the young man in that report saying that it's difficult to even see doctors in hospitals. Nigeria talks about universal health coverage. I don't know what the reality is at MedServ, but realistically, how far have we come from meaningful cancer coverage under programs like the NHIS? How spread, widely spread is this health access?
The government is trying really in terms of access to cancer programs. We're not there yet, but we are trying. And especially at the MedServ Blood Cancer where I work, we're blessed with 10 oncologists. That's a lot. And I think in terms of cancer centers across Nigeria, we have the most number of oncologists at this time. So when patients come to us, yes, they will get care, and we're available to the public Mondays to Fridays. Our doors are open. And we have people come to us from all over the world. I mean, from all over the country. And sometimes we have people come from neighboring countries like Cameroon, like Cotonou, and so on. We do have people come to us. So I'll say the government is trying. We're not there yet, but we're trying. We're making great strides in that respect.
For many Nigerians, they consider cancer to be a death sentence. So when they hear cancer, the first thing that comes to mind is to go to a church or go see a spiritual figure. What are we getting wrong in that regard? What should they do the moment they get the results, the diagnosis?
So once a cancer diagnosis is received, that, by the way, has to do with our belief system, where people think all sorts when it comes to cancer, as opposed to other illnesses, like malaria, like appendicitis, okay, go to the hospital and get medication. But when it comes to cancer, it's such a big deal, and they want to go seek spiritual help and all of that. That shouldn't be the case. So like other illnesses, please go to a hospital. If you don't know what hospitals to go to, you can come to the MedServ Blood Cancer Center or other cancer centers that we have across the country, so that you're seeing the right people who have been trained to help you out with the condition that you have been diagnosed with. Because really, the truth is, with cancer is not a death sentence. If cancer is picked early, and you receive the right treatment instituted at the right time, you can get a cure. You can get free from cancer and become one of the many cancer survivors that we have across the world.
Before we go, quickly tell us what factors could make a person susceptible to cancer, and what are the lifestyle, choices everyone has to start making.
Okay, so risk factors that can make us susceptible: unhealthy lifestyle, like drinking alcohol, like smoking cigarettes.
I mean, you can get cancer for drinking alcohol.
Yes, you can. A lot of alcohol.
You know the number of people that drink alcohol in Nigeria?
I know people drink alcohol, but if you want to be healthy and more aware about your health and
stop it completely, or you take it moderately?
Moderately.
Okay.
And if you can stop it, if you can be a zero alcohol drinker like myself, then go on. Zero alcohol, it will help. Smoking as well, if you can reduce, it will help. And if you can stop totally, it will also help. So other things that can help: healthy lifestyle, like, because, for example, cancers like cervical cancers, they're sexually transmitted through the human papilloma virus. So you need to, if you're married, stay faithful to your partner. If you're not married, then you abstain or you use protection.
You can get cancer by through indiscriminate sex.
Yes, indiscriminate sex can predispose you to cancer. As well, for breast cancer, use of hormonal contraceptives can also predispose you to breast cancer. And also, there are some infections as well that can predispose you to cancer. Okay, so I've talked about the human papilloma virus. Also, the HIV, the hepatitis B virus can predispose you to liver cancer. And there are also other viruses as well that can predispose you to some other cancers.
Good place to leave it. Radiation and clinical oncologist Dr. Bukola Oshikalu, thank you so much for talking to us.
Thank you for having me.